Today in the news, 5 people were hurt in a shooting at a park where hundreds were gathered, and Houston officials used poop to track a spread of COVID-19, and the Dallas Hospital Capacity Report. Today is May 13th, 2020, and this is Dallas Weekly News. Hello, I'm Patrick Washington, and this is Dallas Weekly News. Police have reported 5 people were shot and wounded during a party at a Texas park that drew about 600 people despite local guidelines discouraging large gatherings due to the COVID-19 pandemic. The shootings happened Sunday night at Village Creek Park in Fort Worth. The Fort Worth Star-Telegram reported that according to Fort Worth officer Buddy Calzada, fireworks were set off and then witnesses reporting hearing about 30 rounds of gunfire. 2 of the people who were shot were in critical condition and 3 suffered injuries that weren't considered life-threatening. No arrests have been made. The park was open to visitors, but the city encouraged people to observe social distancing guidelines to avoid the spread of the coronavirus. Officer Calzada said state and federal authorities are assisting in the investigation. City health officials and Rice University scientists have begun testing Houston wastewater samples for COVID-19, a process they hope will reveal the true spread of the new coronavirus as clinical testing continues to lag. The city-led effort makes use of studies that show traces of the virus can be found in human feces, according to the Houston Chronicle. By testing samples of the sewage collected at the city's wastewater treatment plants, officials hope to uncover the scale of the outbreak in Houston and perhaps locate hotspots undocumented by the personal tests. Though Governor Greg Abbott gave some Texas businesses the green light to reopen last week, health officials warn that cities and counties across the state are not conducting enough daily tests to capture how many people are infected with the coronavirus. Further complicating efforts to track the virus are concerns about false negative tests, evidence showing a significant chunk of infected people do not display symptoms, and data that reveals Harris County's coronavirus cases largely have been concentrated close to testing sites. Officials say the emerging effort to trace the coronavirus through wastewater may help overcome those obstacles, though it remains early. Dr. David Percy, the city's health authority, said the health department has gathered initial data, but the area covered by the treatment plants remains too large to yield useful results. According to Erin Jones, a Houston Public Works spokeswoman, the city operates 39 wastewater treatment plants, 33 of which have appropriate equipment and capability to collect the types of samples needed. Houston's population totals more than 2.3 million, according to the U.S. Census Bureau data, meaning plants cover an average of more than 50,000 people each. Lauren Hopkins, a Rice University statistics professor who also serves as Health Department's chief environmental science officer, said project leaders may refine results by studying samples from the 400 or so lift stations that feed the plants, each down to cover much more narrower swaths. For now, plant workers are collecting wastewater samples across a 24-hour period once a week before sending them to Rice University and Health Department officials who then analyze the samples for COVID-19. If successful, the project will reveal COVID-19 trends over a span of weeks and months in certain areas of Houston and citywide. Though less precise than directly testing people for the coronavirus, the analysis will produce cases estimates that include people who lack symptoms because asymptomatic people still shed the virus in their stool. And because workers at the treatment plants are collecting samples across a 24-hour period, the results may provide a more accurate snapshot than the number of positive in-person test results, because that data is impaired by day-long delays in receiving results. Where the data may prove especially useful is in locations where wastewater samples indicate the virus has spread more widely than clinical testing has revealed. Officials can then direct more testing to those areas, including through a mobile unit that launched earlier this week. The new testing method, part of the field of wastewater epidemiology, has begun taking hold in other cities, including an unidentified large metropolitan area in Massachusetts, where a lab found there were more than 2,300 of the 115,000 people infected with the coronavirus, far more than the 446 reported cases ABC News reported. Similar testing is taking place at the University of Arizona, which runs a research facility at the wastewater treatment plant, and Stanford University, where researchers are testing samples collected by a municipal utility district in Oakland, California. So far, Houston and Harris County had recorded 4,053 active cases of COVID-19, 2,189 recoveries, and 114 deaths. The tally of cases has fallen in recent days from an apparent peak in the early April, though officials have warned that a backing of cases may be presenting a dossier picture that isn't reality. Though the city has expanded its clinical testing capacity, it has not reached the threshold of 3,000 to 5,000 daily tests that Mayor Sylvester Turner said was needed before lifting restrictions on businesses. By noon last week, officials had conducted 351,000 coronavirus tests across Texas, according to the Department of State Health Services, making up about 1.2% of the state's 29 million residents. Despite a recent spike in deaths, Abbott has expressed optimism in the generally declining rate of positive results per test and cases that require hospitalization. And now, the City of Dallas Hospital Capacity Report. This has been Dallas Weekly News. I'm your host, Patrick Washington, and you can find these and more stories on dallasweekly.com. And of course, follow us on social media at Facebook and Instagram, YouTube, and Twitter. And of course, as always, stay home, stay safe, and we will see you tomorrow.